Very warm welcome to all the guests present here. Sashakt-The Ovarian Cancer Foundation, in collaboration with Carers, India's pioneering integrative oncology company, extends warm greetings to the esteemed congregation of philanthropists, vanguards, experts, and influencers to the launch of Woman-to-Woman Mentorship Program with a shared vision to create a supportive framework during the challenging journey of cancer patients across diagnosis and treatment. Filled with gratitude and deep appreciation for the inspiring presence of our illustrious panelists, we welcome Mr. Rajiv Khandelwal, renowned actor, Dr. Meenu Walia, Vice Chairman, Oncology, Max Super Specialty Hospitals, Ms. Samara Mahindra, Founder and CEO of Carer, and Mrs. Megha Ahuja, the founder of Sashakt. We even extend a special welcome to our brave hearts, the mentors on board, who have themselves sailed through this testing journey and emerged triumphant and now stand as the beacon of hope for innumerable souls. I proudly welcome Ms. Manju Katyal, Ms. Manisha Kumar, Ms. Deepta Arora, Ms. Deepika Bhatia, Ms. Madhu Juneja, Ms. Poonam Jha, Ms. Sumedha Agarwal, Ms. Nidhi Vij, Ms. Meenu Madan, Ms. Nishtha Gupta, and Ms. Mona Chaudhary. Your presence in itself is a ray of hope for all. Cancer is a soul to spirit transformative experience that leaves a legacy of faith and resilience. And our mentors, having braved the ordeals of time, truly deserve our salute and accolades for offering their kind services as mentors to the cancer warriors in their care. We also welcome all the cancer warriors who have determined to sail against the winds with hope and positivity. You are braver than you believe, stronger than you seem, and beautiful beyond words. Today, we are here to introduce our Woman-to-Woman Mentoring Program, a compassionate initiative that pairs cancer patients with seasoned cancer warriors. As we launch this transformative program, we envision a tapestry woven with the threads of shared experiences, where the indomitable spirit of one becomes the guiding light for another. Beyond insights and support, this is a journey of profound connection, a space where empathy flourishes, courage takes root, and no woman stands alone on her path through cancer. They say every setback is a setup for a comeback. On this promising note, we open today's panel discussion with our esteemed board, which would be followed by an interactive session with the mentors and mentees. The audiences may note their queries in the message box to be referred to later. During the session, we would be keeping everybody on mute to avoid any kind of disturbances, but later we would be catering to all the questions and queries that you must be having, and you would be able to unmute yourself in due course. I would open the panel discussion with Mr. Rajiv Khandelwal. So we're glad to have you here with us today.
All right. Hi, everyone.
So, yeah, please go ahead.
Let me just say a few things here.
Sure.
Firstly, I'm here in the capacity of a panelist, but from my heart, I think I'm here more as an audience because I'm come here to meet all these people who are here today, because there's so much to learn from them. There is so much to understand from them, that what makes them who they are. The fighters and the survivors and the warriors and whatever we may call them, with all the names. I think they are for me, they are they're heroes, and in many ways they are heroes. Also because this is coming from someone who's seen cancer at home, and very closely dealt with somebody who passed away because of cancer. Uh, Let me also congratulate, by the way, let me congratulate both Megha and Sarah for coming together and doing this, because this is actually so unique and so beautiful, because this kind of learning, this kind of bonding cannot be beaten, in a sense. When I mean, there cannot be a better learning, better understanding than the on ground understanding. आप कितनी भी किताबें पढ़ लो, आप गूगल पे चले जाओ, आप डॉक्टर से मिल लो, वो एक तसल्ली जो होती है, आपको डॉक्टर्स होते हैं, बट एक तसल्ली फिर भी एक आपको एक अपने फेलो सर्वाइवर या फेलो पेशेंट से मिलती है, या जो जा चुके हैं, जो घुस चुके हैं उसके अंदर और जो सर्वाइव कर चुके हैं. To get something from them is like, I think that is a very different strength. So to have an initiative like this is a great initiative, and congratulations, Megha and Samara, for bringing all of them together, bringing us together, and I'm sure this is going to multiple. This is going to be a chain reaction, because I think everyone is going to benefit from this initiative. मैं सिर्फ इतना कहना चाहता हूँ before I kind of wrap up. I just want to say one thing, which I go back to my mom thing. Cancer में डर यही लगता है कि हम that we are going to die, and any disease which the let's say the averages say that it is going to be fatal or whatever, and we refuse to fight. And then there are exemplary people like the warriors and the survivors who actually come out of the blue and show you a different perspective of life, a different perspective of struggle and whatever. I just want to say one thing, that we all have to die. Very clearly, we all have to die, and it's a very practical thing coming. Because I know, अगर अब मेरी मम्मी अगर जिंदा होती हैं, अगर वो कहीं पे भी हैं और वो पीछे मुड़कर देखें, तो वो ये सोचती होंगी कि यार वो लास्ट के 2-3 साल जो थे, मैंने फाइट क्यों नहीं किया, मैं किसी मेंटोर से मिलने क्यों नहीं गई, मैं किसी और सर्वाइवर क्यों देखा मैंने. Because she was scared in the last 2.5 years, and she did not put up a very brave fight. Now, this is what I want to request to all the people who are going through cancer right now, that this is not the end. You will have to put up your best foot forward, ताकि आप जब आगे जाके पीछे मुड़कर देखें तो आपको लगे कि हाँ, हमने पूरी we had really put our best foot forward. We had put in all our might and strength in fighting of cancer. So we all have to die, but then मजा तो उसमें है कि आप लड़ते लड़ते हीरो की तरह से आप जाएं या सरवाइव करें, जो भी कुछ है, बट लूजर की तरह से नहीं, मत जाइएगा, because I really feel that you need to put in all your effort. So thank you so much for coming here, and thank you so much for all the people who have battled cancer and are surviving and are exemplary and are so inspirational. Thank you for coming and doing this for them, because I know there is no monetary things involved, I'm sure, but जो हाई आपको मिलेगा और जो आप सोसाइटी के लिए एक एग्जांपल छोड़ के जाएंगे, I think it is going to be unparalleled. So thank you so much for being here.
Thank you so much, Rajiv sir. That was a kickstart to the session, I would say. So, since you've told us you've been so close to the entire cancer journey, right? So, tell us, how did your personal journey of losing your mother to ovarian cancer shape your perspective on the emotional support that cancer patients need? And how do you believe your experiences can resonate with mentees in this program?
So, when it hits you for the first time, it's always a fresh experience. It just comes out of the blue. आपको मालूम पड़ता है, मम्मी ने फोन करके बोला आपको कि बेटा मुझे detect हुआ है stage 3 ovarian cancer, and it's like 3rd stage and etc. So it just hits you. But then for me, the moment वो phone call आया उसके बाद में, I said, Mom, you're coming. She was in Jaipur, and I said, you have to come here. And I think within a couple of hours only, I made up my mind that I'm going to put up a fight, and Mom का मैं हीरो हूँ और मेरी वो मम है, तो मैं I will do whatever I can, and with whatever means that I had and things like that. So मैंने मैं 1 घंटे के अंदर आई थिंक आई वाज अ चेंज पर्सन. मम्मी ये मत करो, ये मत खाओ, वो मत खाओ. नाउ लेट्स सी, लेट्स टेक द guidance of the right kind of people, right professionals, right doctors, and we do this. इस पूरी जर्नी में only one thing I missed, and that one thing that I really missed, which I really miss today also, was that strength of my mom. मतलब अगर वो मिलता तो आई एम श्योर शी वुड हैव सर्वाइव्ड एंड शी वुड हैव बीन अ डिफरेंट पर्सन ऑल टुगेदर. उनका सिर्फ सरफेस लेवल पे एक स्ट्रेंथ थी, व्हिच इज व्हाट आई एम गोइंग टू टेल ऑल द पीपल हु आर बैटलिंग कैंसर राइट नाउ. देयर आर टू काइंड ऑफ थिंग्स. एक तो आप अपने आप को ही बेवकूफ बनाते हो कि नहीं मैं बहुत स्ट्रांग हूं, मैं बहुत स्ट्रांग हूं, मैं लड़ लूंगी और हो जाएगा, लेकिन अंदर से आप वो एफर्ट्स नहीं डाल रहे हो. इट इज नॉट जेन्युइन. यू डोंट कांट सिट कामली. आई थिंक नोबडी कैन. ऐसा नहीं है कि मुझे चोट लगती है तो मैं बहुत कामली बजाता हूँ, या मेरी कभी इंजरी होगी तो आप यू ऑफ कोर्स पैनिक. But then when it is something like this, it is very important that you have an inner strength, not an external strength, because that's what I miss in my mom. कि आप मम्मी को मैं बोलता था कि मम I want you to be at peace, smile, be positive. So she would give me a fake smile, but I knew that the woman is panicking, that my mom is panicking. And वो मैंने कितना मैं उनके साथ बैठता था उनके साथ में. I used to sit down with her, I used to give her acupuncture, acupressure, प्राणायाम करवाता था, मैं योगा करवाता था, but I knew everything was on surface. So when finally mom mere paas se nikli and I had to say bye to her, I mean I cried. I know I at the airport I went and I just didn't want to show my tears. I cried and I cried in the airport. COVID ka onset tha, thankfully mask the aapke paas mein, so I could just hide my face. But then I just cried and my crying was only because ki mom, I wish you had given me this much. aap mujhe 6 महीने की भी strength दी होती ना तो मैं बहुत कुछ कर जाता लाइफ में. तो मैं I just want to say that केयर टेकर भी इतना ही कर सकते हैं. यू नो, यू कैन रियली एज अ केयर टेकर दे कैन ओनली गिव यू द बेस्ट पॉजिटिव सिनेरियो, बट you will have to amalgamate with it. You will have to like kind of take it in you. मतलब आपको पॉजिटिवली लेना पड़ेगा. ऐसा नहीं है कि आपके कमरे के अंदर सब लोगों ने बहुत सारा पॉजिटिव एनवायरनमेंट बना दिया, अच्छी लाइट, अच्छी लोकेशन, आप स्विट्जरलैंड चले जाएं, कहीं चले जाएं, उससे फर्क नहीं पड़ता. I think आपका mental setup है is what I learned from my mom. That's the only thing that I learned, and I'm talking absolutely like a layman. I have got no expertise in that. There's Dr. Meenu Walia and there are others who have far more expertise in dealing with it. But I'm just talking as a caregiver कि आप कितना भी अच्छा environment create कर दो, लेकिन if the patient is not willing to take it, if the patient is not willing to imbibe that, it doesn't work. So अपने caregivers को भी थोड़ा सा प्यार दो ना. वो तो आपको इतना प्यार देंगे, अगले कई सालों तक आपके साथ में रहेंगे, but you also have to give them love and reciprocate that love by giving them the strength that they are asking you to demonstrate.
Right. Thank you so much, sir. So basically, the first medication is actually your inner strength.
I wouldn't know that, but I always say that yeah, it starts from there. Starts from there for me.
Right. I would now request Dr. Valia. Ma'am, could you share with us that having invested your lifetime in treating innumerable patients, what aspects of patient care do you think extend beyond medical treatment? And how can mentorship provide valuable support in those areas?
Before I begin, I must appreciate this wonderful initiative of Sashakt. And when Megha shared this, the whole idea with me, and I was really thrilled and really appreciate that someone could think of this and do something. I mean, these support groups actually are very common abroad. But in our country, somehow we seem to be lacking. So many reasons. There are a number of reasons. Patients don't want to talk about it. Their families don't want to talk about it. The healthcare infrastructure is so strained that there are not enough resources to have these kind of support groups and their regular activities. But really appreciate the efforts of Sashakt, Megha, and the Sashakt team for having come forward for an idea like this. There is an old Chinese proverb that says that to know the road ahead, ask those who are coming back. That is exactly the entire gist of it. One who has treaded through that path. Those are the people who are the best ones to guide you. I mean, we as doctors, when sitting in our chambers, yeah, even for that matter, even the caregivers, Even the caregivers, when they tell the patient कि कुछ नहीं होता, कोई बात नहीं मामा, कीमो लग रही है, कुछ नहीं होएगा, थोड़ा सा होएगा, सब हो जाएगा ना, कैंसर ही है, we will come out of it. So when the one can imagine what the patient must be going through, कि तुम्हें क्या पता? I mean, sitting across the other table, you really can talk n number of things, but that really matter. That doesn't really amount to the same thing when a person who has gone through a similar journey and that person comes and sit, because this person is the one जिसने वो रास्ते पे वो चला हुआ है, and उन रास्तों में कहाँ धूप है, कहाँ छाया है, कहाँ गड्ढे हैं, कहाँ टर्न्स हैं, who has already gone through that way. I mean, he or she knows best कि जब हम पहले पेट कराते हैं कुछ दवाइयों पहले ट्रीटमेंट के बाद, जब हम पेट सीटी रूम के बाहर बैठे हैं और पेट सीटी की रिपोर्ट आ रही है, तो किस तरह की एंजाइटी होती है, क्या सवाल होते हैं, व्हाट इज, आई मीन देयर सो मेनी पेशेंट्स हु कम एंड टेल मी कि जब वो फॉलोअप से भी आते हैं कि जो वो टेस्ट करने से पहले जब अस्पताल आते हैं ना, तो वो 2-3 दिन 1 हफ्ता उनको नींद नहीं आती, बिकॉज दे आर सो एंशियस कि अब पता नहीं क्या रिपोर्ट्स में निकलेगा, क्या बताया जाएगा, एंड देन व्हेन यू टेल देम कि यस ऑल इज वेल, सो अब मेरे 3 महीने शांति से बीतेंगे. So these are all the things when one listens to somebody, so it makes such a lot of difference. And I strongly believe that जो कैंसर की लड़ाई है ना, it is a lot to do with this. I mean, it is you have to win this war in your minds first before you actually come out of this fight, before you actually win the war. And that is why it is very, very essential that a patient is helped. A patient, whatever you want to say, a patient, a cancer survivor, or a warrior, or a fighter, whosoever is dealing with this disease. And not only that person, I feel the family also needs to be helped in a way that they can actually win this war. And first they have to accept it here. Till now, we have, the minute the diagnosis is made, half of us, more than half of us have already lost the war. We have lost the war emotionally. We think, I mean, the mentally we accept कि शायद कुछ नहीं हो सकता. Even when we try to put a brave front, we are not actually believing that we can do it. That is the whole idea why this kind of an initiative should be there. And then again, what you said is cancer treatment, cancer of all the diseases, cancer treatment is not only about surgery, radiation, chemotherapy, or this and that tablets, which we normally feel. I mean, imagine the plight of a person. You are shoving him from one doctor to another, one hospital to another. ये ले लो, ये दवाई खा लो, ये कीमो साइकिल होएगी, अब ये होएगा, come next, show me the hemogram, blood test ये है, TLC इधर जा रहा है. No. I mean, apart, yes, probably it is a whirlwind where that person is lost, the family is lost. But apart from that, somebody needs to hold the hand. Somebody needs to sit and say that this too shall pass. And that somebody, the best person to do that is not your doctor, because the patient will never believe, because doctors are polling. I mean, they are not actually, only the wearer knows that the shoe pinches, and even not your family members. And the other thing which I strongly feel is when you have a mentor, when you have a buddy who has gone through a similar journey, the thought that comes to me is not that कि वो अपना experience share कर रहा है, उसके अलावा the thought that comes to my mind will be, if he or she can do it, then why not me? मतलब वो भी तो एक इंसान ही है ना, एक something with almost the same kind of resources. He or she is also a human being. If that person can come out of that journey, then of course there must be something that I can also. And that hope with the buddy, with the survivor, instills in the patient, there is no match to it, no n amount of neither any kind of words or books or any kind of counseling can help and achieve the same result.
Right. Thank you so much, ma'am. So looking ahead, we can say that this mentorship can actually act as a vital contributor, a prominent tool towards a more comprehensive approach to patient care.
I rather think this might become the backbone of the patient care, much more than anything.
Right. Thank you so much. Samara ma'am, we would want to know from you. We're very eager to know what inspired you to establish Carer, and how do you see integrative oncology contributing to the overall well-being of cancer patients?
So again, I would like to start by saying a big thank you to Megha. She got this idea to us, and while we work with thousands of patients, and while we do provide nutritional, physical, psychological care, one thing that patients always ask us is that can we speak to someone else who has been through this journey? And considering that I have been through it myself with my mother, I understand the empowering that can be for a patient. And it was really quick. Within a couple of weeks, she came with the idea and then just powered through and made it happen. And I think I want to definitely acknowledge Dr. Meenu Walia, because she's one such doctor who has advocated and promoted integrative oncology, patient care, supportive care beyond medicine as a holistic approach to treating cancer. So that's extremely important for our patients, here today. Now, my journey began, most people would know this, is because of the loss of my mother. I think we've all been touched by cancer in some way, shape, or form. I think when we have experienced cancer in some way, you can't look at the world the same way again. In whatever capacity you want to do something, whether that's spreading, the right information about it, whether it's starting what Megha started, whether it is, doing what we have done, you just can't look at the world the same way. So my journey started the same way. I lost my mother to cancer, and while I was very grateful that she had access to the best medical care, her quality of life was extremely poor. My mother was a very strong, dominating, extremely successful businesswoman. I say this all the time. She used to, have her chemotherapy sessions and then tie her bandana and go to work the next day. She just lived like this, kind of pushing it aside and not really acknowledging it. And while that was great, maybe, and really helped her power through, not acknowledging, not accepting the diagnosis in some way was somewhat, that led to her lack of, fighting this disease later on in her prognosis. So we went through cancer many years with her. Hospitals and doctors and nurses became our second home and members of our family. And then eventually, I could see that she mentally gave up. Like I said, she had stable medical reports actually, but I think when we saw that she was not ready to get up and go to work anymore, when she was not ready to get out of bed at one point, I remember going to my sister and saying, I think it's time. And believe it or not, within, I think about maybe 30, 40 days, she passed away after that. So I firsthand experienced what it was to be a caregiver and somewhat a patient who was, getting great medical treatment, but was not being supported with her quality of life, with her mental health, with her nutritional, parameters, so on and so forth. So after she passed away is when, I started my journey understanding what we can do to actually provide support to patients, holistic support to patients and to caregivers. And that's when I was exposed to the world of integrative oncology, which is just a medical term of complementing mainstream, cancer treatment along with non-clinical evidence-based therapies like nutritional support, physical support, and psychological support. And I will, say this, that today, of course, I've had the opportunity to work with renowned oncologists and institutes and thousands of patients. But what stands in the forefront of really helping a patient get through this journey, as well as caregivers, is their psychological state of mind. I have seen and experienced this firsthand, where providing support to patients and caregivers, whether it is through counselors and more so through programs like this, where they have relatability with another person who has walked that path and walk through successfully can be extremely empowering. And we have innate, just power and fighting force that comes into patients who are losing hope when they connect with similar individuals who've gone through this journey. So this has been, something that I have seen, and I applaud Megha to have, and thank you for bringing this to us so we can contribute in some way.
Thank you so much, Samara ma'am. Thank you. Megha ma'am, we would want to know what inspired you to initiate and lead this woman-to-woman mentorship program, considering it originated from your vision and passion. Can you share the motivating factors and personal experiences that fueled the creation of this impactful initiative?
First of all, I would like to extend my heartfelt gratitude to each one of you for joining us today. Thank you so much, Samara, for this collaboration. We couldn't have made it possible without you. And of course, Dr. Walia has always been there in all our initiatives, because for a doctor to support this kind of initiative is again something which is rare, because usually what happens is that from their end, it's only the medical journey which is focused on, and the other factors are being ignored. So thank you so much, ma'am, for supporting us. And thank you so much, Rajiv, for always being there. I just have to tell you, I'm doing this, and the kind of support that comes from you, it's something that helps us keep going always. And talking about the program, women-to-women mentorship program, the whole idea was that what happens is that whenever somebody is diagnosed with cancer, there's a whole lot of thing that is going on in their mind. There's a lot of anxiety, there are a lot of questions, and all those questions they cannot ask from their family, because family has no experience to be. They're again something who are on the journey together, and they're again clueless about all those things. And with the doctor, they get a limited time in which they're only able to interact about the medical part of the journey. So what I felt was that if they could get someone during that time who can answer those queries and handhold them through the journey, it can make the journey quite easier. Talking about the personal experience and motivation behind it, as most of you know, both my parents, parents have seen the cancer journey. So my dad is also a cancer survivor. So when my mom was diagnosed, she had dad as that mentor, because she's seen the journey, and she always believed that like he has gone through the journey and he's fine now. She always believed that she's going to be fine as well, and she gave that fight till her last breath. So having a role model, I felt, can be a great help during this journey, and that's what led to this whole idea of woman-to-woman mentorship, where I felt that getting a friend, getting a mentor during this time can make the challenges a little less.
Hello. Hello. Hello.
Thank you, ma'am. Your vision envisages not only emotional and moral mentorship, but it encompasses an empowered journey of treatment and recovery, I would say. Rajiv, sir, we would want to come back to you. We would want to know, in what ways do you think the entertainment industry, where you're prominent, can contribute to raising awareness about cancer? And how can it play a role in destigmatizing discussions around the disease?
I think it's as simple as that. Firstly, I think all the public figures who have gone through this, because it's not that cancer happens to a certain kind of people. There are so many actors, and there are so many directors and public figures who have gone through cancer. Rishi Kapoor, we lost Rishi Kapoor to cancer, the actor. Irfan Khan. I think they should come out more in the open. They should actually just tell how they're dealing with it, and more people who are going through it if they come and tell their stories, which they do, some of them do, but I think it's all about living in a society where everyone talks about it, everyone shares their personal experiences, and which would actually give a lot of strength to people who are going through it. Otherwise, you don't hear too many people who are very well off. You don't hear them. You just hear that कि वो चले गए. But उनकी journey कैसी थी वो they don't share that. I just hope that being public figures, it would be nicer if they share their own journeys. And of course, if there are more films made, there are more projects made which deal with this and in a much practical manner, not in a filmy manner. The way I have seen it up close, and probably all of us, we have seen it up close. We don't want a film which doesn't really give a genuine support to people who are kind of going through it. So I think if more projects come around it and the people make more projects on it, which are relatable, which are practical, which are pragmatic, I think that would also make a lot of difference. But essentially, I feel that anyone who is going through it should not keep it close to them, themselves. I think it's absolutely fine to go through it. मतलब कितने लोग शौक से बोलते हैं कि शौक से इन सेंस कितना वी डोंट केयर, आज मुझे स्लिप डिस्क हो गया, आज मुझे ये हो गया, किसी को ये हो गया, कैंसर बोलती है, पता नहीं क्यों they don't want to share it, including my mom. So she wasn't letting me tell the whole world. So I think it's important that we all talk about it. The more we talk about it, the lesser the intensity, the so-called intensity of cancer would be, and people probably would be able to deal with it like they would deal with any other disease. Of course, there are technical sides of it. It is not a very easy disease to deal with, but it's not something which people haven't beaten in the past. So I think the more we have conversations about it, the better it would be for people who are going through it.
Right. We actually are aware and alive to the industry's potential impact on societal perceptions. So that can actually act as a great force towards removing the stigma attached to the disease. Thank you so much, Mr. Rajiv. Going on to Dr. Valia. Doctor, could you throw light on what are the common misconceptions or concerns that cancer patients often have, and how can this mentorship help in addressing and clarifying those issues?
So again, really glad that you asked this question, a very, very relevant question. And the n number of misconceptions, n number of misconceptions also. And that is the reason the cancer remains undetected for a very, very long time. And even when it is detected, after that also patients are going in all kind of different things rather than what is required. So something like, I'll begin with something like if most of the breast cancer patients, even in the metros, even in cities, I mean, I'm not talking of remote areas. So there was a principal of a school, I remember, she had come to me and with a huge breast lump. It was something around 8 centimeters in size. And the first question is, how come? I mean, the lump is there for how long? That is the first question that we asked. And the answer was, it was there for last 9 or 10 months. And I mean, I'm talking of, again, she's the principal of a school, an educated lady, and Delhi NCR coming with a lump, and she is having a lump in her breast for last 8 to 9 months. And the first thing I asked is, why you have not got it tested earlier? The answer was, क्योंकि कोई problem ही नहीं थी, मैम इसमें कोई problem नहीं थी, why should I get it tested? So that is one thing, I mean, which I always keep on saying, if anything which is a painless lump does not mean that it is harmless. So if there is a lump in any part of the body, I mean, that is what normally happens with Indians is that agar, matlab, even if they find something abnormal, they will not go to a doctor, they will not get themselves tested because unko lagta hai ab to battery of test ho jayenge, without realizing that something which is painless, which is may not be as, it may not be something which is harmless. It is the lump. If it is a lump there, if it is a cancer lump there, it is growing in size, and by the time, most of the time, we relate that if it is cancer, it has to be pain. So what we have to understand is, in the initial stages, cancer is very, very silent and it doesn't cause pain. Pain generally happens when it is an advanced stage, and more by the time the patient comes, then it is generally late. So that is one thing that everybody needs to be aware of. Second thing is that also there is a big myth about not about getting a biopsy done. Many times you have patients, they have been having lumps in the breast and they don't land up, or they, even when they go to the doctor and the doctor has advised biopsy, then they will disappear. They don't want a biopsy because the misconception is कि अगर हमने biopsy करा दी तो ये फैल जाएगा. जब तक biopsy नहीं कराई तब तक it is contained. And this is also a very a lot of misconceptions about it. It's a big myth because they don't understand. अगर biopsy नहीं होएगी तो हमें पता नहीं लगेगा कि पहली बार तो diagnosis ही confirm नहीं होएगा. अगर और साथ में आपको नहीं पता लगेगा कि किस type के cancer के cells है, so that you can give dedicated treatment. So the tissue diagnosis is very important in all them, because cancer is not one disease. It is lot many diseases, and the tissue diagnosis is very important. So this is also where these buddies can even help the patients who present with lumps, who come and then who are really reluctant for biopsies and don't want to get invasive tests done. Then a lot of other misconceptions, like many times we find that this Samara already said, I'm a great supporter of all these, what do you say, these alternative therapies or integrative healing. So because I strongly believe that it is not medicines alone that heal, it is so many other things also which are important part of the treatment. But many times what happens is the easier path is more alluring. So patients will go into everything else rather than this also. I mean, all these alternative therapies are complementary to the main therapy, but they should not be in lieu of the main therapy. So I still remember, I mean, this was my early days of my career. I had seen a young boy that was, I think, 12 saal ka bachcha tha, and the father, the whole family had come and we diagnosed him to having Hodgkin's lymphoma. So Hodgkin's lymphoma is a curable malignancy. बिल्कुल ठीक हो जाते हैं इसके पेशेंट, बच्चे ठीक हो जाते हैं, दे टर्न आउट टू बी लॉन्ग सर्वाइवर्स. सो वी उसमें टेस्ट हो गए थे. पहले तो बायोप्सी में बहुत टाइम लगाया, यही कि बायोप्सी से छिड़ जाएगा, ये हो जाएगा, वो हो जाएगा. But finally the biopsy was done and diagnosis was made, everything was ready. Now the part was, let's start the treatment. And then the patient disappeared. The whole family disappeared. The whole family was so anxious, so keen in the, I mean, morning में भी बात हो रही है, शाम को भी they are ringing and they really wanted to discuss, and then they simply disappeared. So once they did not turn up for treatment, then I really asked my coordinator to get in touch with them, because my idea was, I mean, I told my coordinator just to tell them that they should start the treatment. If sometimes what happens is there are certain logistics issue with one particular hospital, आपको किसी जगह पे कोई logistic issue है, but at least start the treatment wherever, whether you go for X, Y, Z, but start the treatment. So I made my coordinator ring up that person, and the result was, answer क्या आया कि उन्होंने treatment कहीं भी शुरू नहीं कराई. That was very sad. And what he had started saying कि नहीं, हमने एक XYZ को दिखाया था, and then वो मतलब वो cow's urine, and they started these kind of treatment. So these are the things जो आपको बहुत दर्द पहुंचाती है कि rather than having a evidence-based treatment, you go for everything else and then believe that that is going to take care of the disease and not having the treatment at all. So there are so many times people go for alternative things. They might be good. Discuss with your doctor, discuss with your caregiver. Lot many things. Sometimes we only say, okay, yes, this should be part of the integrated treatment, but that doesn't mean that you will be cured by that alone. So another patient of mine, I remember, a very God-fearing lady, and she was like totally into कि मैं वो अमृत पी रही हूँ तो मैं अमृत से ठीक हो जाऊंगी. I mean, with so much of faith she had, and actually we lost her then after that, after some time. But idea is that, I mean, one has to also understand God helps those who help themselves. God never says कि आप treatment नहीं कराओ. आप मेन ट्रीटमेंट को, आपको एविडेंस बेस्ड ट्रीटमेंट कराना, उसके बाद आपको ये ऑल्टरनेटिव थेरेपीज लेनी है. सो दीज आर सम काइंड ऑफ द पॉपुलर मिथ्स. देन अदर वेरी कॉमन मिथ्स दैट वी हैव इज sugar increases your cancer, and milk वाली चीजें आप खाओगे तो उससे कैंसर सेल्स बढ़ते हैं. So there's a lot of data on the net about it. But again, it comes to what is evidence-based is more important. At present, we have no conclusive evidence that this increases cancer, but we still say limit your sugars, because what it does to your waist and other things is definitely not good. Till the time we don't have evidence, पहले ही उनको खाने के लिए इतनी मुश्किल हो रही है, नहीं खा पा रहे, तो at least we don't want to make it that difficult for them. And plus n number of other things, alkaline diets, diet के बारे में इतना कुछ. And I always tell my patients कि जब एक बार कैंसर डायग्नोस हो जाता है ना, तो आपकी जो काम वाली बाई भी है ना, वो भी आपकी एडवाइजर बन जाती है. जब आप सबको बताते हो ना, तो वो भी आके बताएगी कि आप ये खाओ, आप चाय में ये करो, आप वो करो. एंड इतना ज्यादा इंफॉर्मेशन बम्बार्डिंग होती है कि आप उसमें ही गुम हो जाते हो. एंड जो राइट प्रॉपर थिंग है, you don't follow that. And that is where the role of these buddies will come, because everybody is your advisor. And even on the internet, if you go, you will be lost in the what you say, the information fatigue syndrome. There's so much information, and 90% of is all illogical and not the right one. So selecting the right information is very important, and selecting the right information is somewhere your buddy is going to help, who has gone through the similar journey and who knows that yes, what was done and what was not done, maybe in consultation with your doctor.
Right. Thank you so much, ma'am. That I suppose is a line of guidance for everybody present here. Rajiv sir, we would want to come back to you. We would want to know that you have sailed through the pain of seeing a loved one suffering. And sometimes this suffering takes a toll on the health of the caregivers as well. It makes them vulnerable to hypertension, diabetes, anxiety, stroke, etc. This guilt and helplessness at both ends make things even worse. What advice do you have that you can extend to our warriors and their families in this regard?
To the families, all I can say is that, दो किस्म के लोग होते हैं. They take it, some people take it in a certain manner, some people take it in a certain manner. Please make Samara and Megha as your heroes, those who have actually given care to their families. And this is what has happened to them. This is how they came out. They came out and they started helping others. That's how you take it positively. That's where you don't let it affect you. You in fact think that, okay, what can I do? The kind of initiatives that, and these young women, they've started off and they're helping so many people. तो वो तो हर इंसान के ऊपर डिपेंड करता है कि how much you start blaming yourself, which people do. No amount of my advice will actually stop them, because one has to believe that कि आप भगवान नहीं हैं, आप सिर्फ केयर गिवर हैं, आप भगवान नहीं हैं, आप कुछ नहीं कर सकते. जो मैंने समझा था इस बात, I learned this thing that suddenly in 2 years I started believing that I'm going to be my mom's hero. जो फिल्मों में आप देखते हो कि मम्मी का बेटा है, ये मम्मी को बचा के लाएगा और ये करेगा, वो करेगा, और आप भी अपने आप को हीरो ही देख रहे हो. और वो हीरो की जब दिल टूटता है या जब वो हीरो फेल होता है तो बहुत दुख होता है. तो मुझे भी almost to an extent, because when she was finally going, so I felt terrible. But then I realized I had spoken to a lot of doctors and a lot of people, and I asked them that, what else could I have done? And then the only thing that you hear from them is, Raji, you did your best. And that's what every caregiver who is actually doing their best should believe, that they have done their best. And rest is, I would say, a lot depends on the patient. And at the same time, then rest is your destiny and the patient's destiny. So कभी भी खुद को blame करना, तो I think is a very easy way out. That's also like, आप सीखे हो तो उसे बांट ही लो आप दुनिया को कुछ. Some people may just benefit from it. So caregivers should understand that they are not gods. They are just caregivers, and that's all.
You made it sound so simple. Thank you so much. Samara ma'am, would you tell us, in your long tread entrepreneurial journey, what obstacles have you encountered in advocating for integrative care? And how can mentorship programs play a role in overcoming such challenges?
So that's a great question. So there are multiple obstacles we all face, no matter what we do, whether we start an entrepreneurial journey or, we start any kind of endeavor to achieve something or solve something, we all face obstacles. I'm going to speak more about the obstacles starting from me, where, and I think even Rajiv and everyone else mentioned it, is that while we are touched by cancer and we want to give back, I think we have to also build a resilience to be able to take this journey on. And I'm sure Megha can kind of vouch for this as well. At least for me, I don't know if I was ready to take the journey when I did. I jumped straight into it. And I remember when I had an opportunity to work with Tata Memorial Hospital under Dr. Shailesh Shikhande. And so he was, wonderful enough to allow me to sit into consultations of his. So it was so strange that I was now sitting on the other side of the table with him, just watching and observing. And I would see myself, my sisters, my mother walking in, just like we did, sitting across the, doctor in panic, overloaded information, like Dr. Meenu said, had no idea. The world gave us advice, but no idea what to do. And it was like a mirror, and I kept seeing that happening. So the first obstacle really was to kind of accept my own journey and to build a sort of resilience so I can help other people. And that's what I also, want to say to the mentors, is that it's phenomenal what you're doing. You are the champions in this, to hold the hands of those who are walking this journey, but also be kind to yourself. Also realize that it might bring back certain memories, and that's okay. And to, try and find resilience through that, because we need to do that for the people we're, helping. So the first obstacle was that, and of course there are, I still experience it. I'm sure we all experience it. But that was the biggest one that I can really speak about, because we all want to do something. And then come to us and saying that, we are panicking and we are experiencing what we experienced a while ago. So we need to be ready to take this journey on. The other obstacles was, as Dr. Meenu said, there's a lot of misconceptions. And as she rightly said, your neighbors, to everybody will give you advice. We talk to caregivers where they have become, pseudo doctors. They know more about the medical diagnosis, and they become almost manic in trying to find a cure or find a solution, and trying to do the job of doctors. We have to calm them down and say that the doctors will do that job, and you need to be a support system, like Rajiv had mentioned. And so it was trying to set the right expectations for patients and for caregivers, trying to make them understand that medical treatment is important. Because we had a lot of patients who came to us saying that, can we not take the medical treatment, but kind of still go with what you are offering, which is the nutritional, physical, psychological support? And we would say absolutely not. Although every decision lies with the patient, but we are not an alternative to mainstream treatment. My mother, her diagnosis, she had one of the most aggressive cancers. She went into remission, but after 8 months, there was a relapse. And at that time, she was told that, with chemotherapy, it would be a year, without 6 months. But that's about it. We wouldn't see prognosis beyond 6 months. She went on for 7 years. And the reason for that, there are many reasons. I think her state of mind was a big reason. But it was very much the treatment and her medical treatment protocol that she was on that helped her survive this, So we need to understand the misconceptions. We need to understand what are the treatment protocols, and how do we make our quality of life better? How do we, manage the side effects better? And that's where complementary, evidence-based, non-clinical supportive therapies come in. So it's educating India, such a stigmatized disease. Like Dr. Meenu said, you hear the diagnosis and you've kind of lost that, battle by 50% already. It's about talking about it, like Raju said. You have platforms where you have millions of people listening to what you have to say, and we need to encourage celebrities and those, whoever have these large platforms, or any platform for that matter, to speak about cancer, to realize that it is not the end of the road, that fear of the diagnosis or the word comes from a lack of knowledge, and you always understand that empowering yourself with knowledge will actually decrease that fear, and will you beat fear through understanding and knowledge. And majority of cancer lies with that. So I have seen immense change over the years when we have worked. I mean, I've built Carer, where initially patients wouldn't even want to talk about it. Where today we have mentorship programs like this, people are coming on platforms and encouraging others to talk about it, and talking about what are the facts of cancer. So I think it was also just putting out the right information, educating people. That's still something that we all have to continue to do. And then lastly, which I wouldn't say is an obstacle, because again, we see changes, and that's because we have doctors like Dr. Meenu, who are coming out and talking about, hey, integrative oncology is a powerful way of getting treated, and that treatment is important, and complemented by supportive care is even more important. So having the medical fraternity advocate this initially was a little bit difficult, because the focus was on, obviously the medical treatment, but then now we have multiple oncologists, renowned oncologists, who step up and talk about that this is what the treatment will do, but this is also what you require to, expedite your healing and recovery.
Can I speak something? Hi, can you hear me?
You're audible, sir. You're audible.
Yeah, all right. So I am like really, really hard pressed for time. So I will be taking leave, though I don't feel like leaving these wonderful people, all of you people, it's such a wonderful place to be in. And I can sit for hours and hours and hear them, more than speak, maybe hear them and hear and learn so much from them. Or maybe just kind of listen to them. And, just actually again thank all of you people. More than anybody else, I would like to thank all those people who have come forward and who are helping out others, because that's a great thing to do. हम लोग अपने neighbors की भी मदद नहीं करते हैं, और आप लोग you've gone through this whole journey and you've still stepped out and with the intention of actually making a difference in somebody else's life. So all those people who are here to mentor the other patients, I mean, hats off to you guys, and I wish you well. मतलब अभी आपको तो award मिलना चाहिए, मतलब भारत रत्न या मानव रत्न आपको मिलना चाहिए. You guys actually doing it without any vested interest. So thank you so much, and all the best to everyone. Dr. Walia, thank you so much. It's always lovely to hear you, to be in your company. Megha, you are incredible. Samara, thank you so much for joining hands and making me also a part of it. And everybody else, if Nishtha is here, I love this girl Nishtha, who's one of the, I think, mentors here. So love you, Nishtha, and love everyone else too. Bye.
Thank you so much, Rajiv sir. Thank you for your time, and it's been lovely to have you here on board.
Thank you so much, Rajiv, for joining us today.
Pleasure.
With that, I think we would continue with the panel discussion. And Megha ma'am, we would want to hear it from you. Your umpteen efforts in empowering cancer patients have truly touched us to the core. So, in league with your myriad community support events and en route your noble mission, how do you envision the role of the mentors?
Like Rajiv just said, they're the real heroes who are making it happen. I want to extend a heartfelt gratitude to each one of the mentors here. Thank you so much for joining hands with us. Thank you so much for volunteering for this. In the world we live in today, all of us are so hard pressed for time. We are running from one pillar to post to make our own things happen. And out of that time, taking a time to help somebody else voluntarily, it's rare, and all of you are real heroes for doing that. Thank you so much. As far as my expectations from mentors go, the only thing is that you people are going to handhold all the cancer warriors. And while doing so, one thing that I've told each one of you personally also, medical advice is something we really discourage because everyone has their own journey. So we don't want you to, if any patient reach out to you for medical guidance, we would request you to tell them to talk to their doctor for the same. You are there to provide the emotional support, you're there to answer their queries, n number of queries that are regarding other parts of the treatment, whether it is their mental health, whether it is the anxiety they are facing, whether it is while they are going for their particular treatment, what should they expect, like if somebody is going for their first chemotherapy session. So you could at least, after talking to you, they can get to know what to expect. So that's what is the purpose of the entire program, the emotional hand holding. And medical advice is, again, I'm reiterating that it is something that we really don't want to get into, because what happens is, like, if it doesn't suit any patient, it can fail the purpose of the entire program. And of course, thank you so much to all of you for taking out time from your busy schedules and volunteering for something like this, which is real, which is definitely real.
Thank you, ma'am. Thank you so much. We would go on to Dr. Valia. Doctor, could you tell us how, in your view, can the medical community collaborate more effectively with support programs like woman to woman mentoring to ensure a more comprehensive and integrated approach to cancer care?
So again, as I already mentioned, there are a lot of constraints on the medical infrastructure in community also. And the biggest constraint is the constraint of time, resources, manpower. So most of the medical doctors, most of the healthcare infrastructure will be so constrained because of these things that taking care of the medical perspective, the main treatments take a toll on our healthcare infrastructure. And taking into account, trying to integrate all this sometimes become really, really difficult. So on my part, I can say that because probably, I mean, I would also have been in the same constraint. The only thing is, as everybody shared their own journey, I have been a caregiver first. My own, I mean, my journey with cancer started way beyond. My mother had cancer, so I was a caregiver. I could see what a cancer patient goes through. And that was one of the main reasons that you have seen it from the other side of the story and you really know how these things are important. So for me to say something is much easier because saying is definitely easier than getting things done. But yes, in spite of all these constraints and the restraints, the intent has to come, and that has to come even if all is like engaging the patients, engaging your survivors into these kind of systems. You need people to come forward, at least talking to them. The first talk has to be from the treating doctor, that these are the opportunities, and then within the same infrastructure, things can be created for support group also. Though most of the medical colleges, most of these hospitals, they have a seminar hall, they have an auditorium. Encouraging regular support group programs, having volunteers within the group, people who will come forward and talk about it, and that is what is required. So the first and the foremost thing is the medical community also has to understand the requirement of all these integrative things. So again, I said that the constraints are because many times in our experience, we find the patient will only do the integrative and forget about the basic. So that education is very important, and that education has to come from the medical community. And apart from that, encouraging their patients and encouraging and taking something out within the same constraint, within the same time, and within the same infrastructure for support groups, educating the people, and probably leading from the front also.
Thank you, ma'am. Thank you so much. We would want to go on to Samara ma'am. Samara ma'am, can you share examples of successful integrative approaches that you believe could serve as valuable insights for both mentors and the mentees in navigating the cancer journey?
There are thousands, actually, thousands that we experience on an everyday basis. And when we talk about success, are we talking about quality of life? Are we talking about cure? Are we talking about a person who is able to live well for a long period of time? It's different for each person. What's been wonderful is that when we first started, patients would reach out to us saying, "Will you cure us?" And no, but whatever you provide, is it going to be a cure? And we would always say that is not something that we do. We can support you to live a better life. Today, patients and caregivers reach out to us saying, "Will you make our quality of life better?" And that itself is an extremely successful transformation we have seen with patients and caregivers for many years. We have multiple stories and examples where we share a lot of testimonials where and I speak about this as well, where patients and cancer survivors have made radical changes in their lives because they've been experienced something like cancer, something that is quite serious, and they have changed their lives for the better. They have stood up for themselves. They have come out of abusive marriages. They have had stronger bonds with their spouses, and they have started careers, extremely successful careers after this, where before they were just or they were housewives and they always wanted to do something with their lives and their profession, and they then went ahead and did it. And all of these stories are extremely successful. All of these stories we see every day. But the most important that I do want to mention, which I see at home personally, is unfortunately my brother also just went through Hodgkin's lymphoma, and Dr. Meenu said it is a very treatable cancer, but his was a more progressed stage. And he is a prime example of someone who was not living a very healthy life, was working 24/7, ignored his symptoms for, forget about months, years, didn't tell us till we then brought it up saying that there is a lot of swelling. Unfortunately, he doesn't live in India, so we never saw it very often, but we noticed it at my wedding, which was 3 years ago, and he still didn't do anything about it. And then got the diagnosis and went through aggressive treatment for about a year. And today he has radically changed in the sense that he is healthier than he ever was before. He is fitter than he ever was before. He has taken the initiative to start a restaurant, which he has always wanted to do for his entire life. And he is just getting married to a wonderful woman, and his life has changed considerably. And I see this all the time where people then experience something like this and change their lives for the better. They become fitter than they ever were. And these are all no matter how big the success or small the success, these are all extremely successful stories that we see every day. And in a way, I'm blessed. I'm sure Megha can say the same. Is that it teaches us every day how to live and how important life is. And I try to incorporate this in my life, that be healthy, be fit, and also do what your passion is, take those chances in life, and don't let fear hold you back. So many successful stories we experience.
That indeed radiates a lot of positivity, I would say. Thank you, ma'am. Megha ma'am, what advice would you give to women who are currently facing or maybe have faced a diagnosis of cancer? And how do you think can mentorship provide them with that strength to navigate this challenging journey?
First of all, I want to tell all the patients who are going through the journey right now. first thing that we need to do is to downplay cancer. We cannot make it the center of our world and stop living our lives. I know it is a difficult journey. I'm nowhere undermining the impact that it has on you and your life. But if we downplay it and if we accept it and move on with our life like we do with the rest of the diseases, it can make the process really easier. Like if somebody has diabetes, they have to take injections throughout their days and they're still living with it, and nobody keeps telling them that you have diabetes every day. But with cancer, what happens is that as soon as the diagnosis happen, the first reaction is that I'm going to die and my life is ending, which is not at all true. It is a roadblock. All these mentors out there are the live examples of that. They all are living their life successfully and so beautifully after their cancer diagnosis. As Samara just said, that it gives us direction in our life. So many people I meet, so many survivors I meet, and this is the common thing that I see, that it has somehow made their life more meaningful and more beautiful than what it was. So, and parallelly, while you're going through the treatment, it's very important to embrace the support from your family, support from your doctors, support from mentors, like through this program. Because uh, if we think that, okay, we don't want any support, if we averse ourselves to that, it is very difficult. Together only we can sail through this journey, and embracing the support is very important thing in that. Last but not the least is there are brighter day ahead. Look forward and keep seeking solutions to small little problems that come on the way, but always believe that there are brighter days ahead.
Thank you so much, ma'am. Thank you. So, with this, we close the deliberations on this forum. Thank you very much, esteemed panelists, for your insightful observations. Before proceeding for an interactive session with you, dear audience, we would please request you to use the raise hand option so that you may be invited to share your concerns one by one and in sequence. I would request the audience, the members who would want to put up questions, to please raise their virtual hand and we can unmute you all and go ahead with your queries.
Anything you would like to ask all the mentors and mentees, anything related to the program or otherwise?
So I think a lot of questions will come when this program actually starts rolling. है ना? So for now they have understood, and then we will Madhu Juneja. And as the problems come, I think we will all still be there and addressing these things. है ना? But probably I can see Mrs. Madhu Juneja's raised hand.
Yeah, good morning, everybody. I think it was very overwhelming. For me, it was when Rajiv was talking. I was a caregiver of different kind, but when I went through my own cancer journey, I mean, what he was saying, it brought back memories. It was very overwhelming. And I think the way he shared it with all his heart. That's the most important thing. My only concern here is that I think we would need some kind of guidelines, as you said in the beginning, so that at the end of the day, this is a new program. One is, let's hope it continues, because the whole important thing is, I'm being very honest, many things start, but they fall somewhere midway. So let's try and keep it. It's not that we have to have many mentors. Even if we start with 10, 15 and are able to carry it through, I think that's more important. And somewhere I think we would need the guidance of Dr. Meenu, who always puts things so well. Also to, guide us on the boundary setting, which is very important because somewhere, with our own experiences, we would have to maybe meet once in a whatever time, time frame you decide, for us to be guided by the seniors in this group, how to be on the same page. Because if there are 15 of us, going in different, direction, then it becomes very difficult. So the request is just for the seniors to give us some guidance on setting those boundaries when we start this program. That's all. Looking forward to it.
Thank you so much, Madhuji. There will be written guidelines that will be shared
Sure.
with you right after this meeting. So
Sure.
there are 10 pointers that you can go through.
Sure.
Talk about whatever you mentioned about the and of
Right.
course we all have residue, like it is a kind of a mission to take this forward, so we're not
Absolutely.
going to let it go. Definitely.
I know. Thank you so much. Thank you, Megha. Thank you.
Very relevant points, I must say. I mean, there has to be written guidelines and probably frequent meetings also, that she very relevantly said. Everybody has to be on the same page. 10, 15 people, not all in different directions.
With the mentors, we are going to stay connected throughout, and all of you will be like once a week is what we expect you to talk to your mentees. Right after this meeting, today only you will get the phone numbers of your mentees, and mentees will get the phone numbers of the mentors. And after that, you people can take it forward one-on-one, and you can just have the initial interaction with them. And then at least once a month, or if you people need once in 15 days, we can have a meeting with all the mentors to address your queries regarding the program, like when you are interacting with the mentees, whatever problems you are facing or whatever feedback you have to share, we'll do that very regularly, like over Zoom only, so that nobody has to kind of leave the comfort of their home. So we'll keep an online meeting with the mentee. I think Ms. Madhu want to say something. Can you unmute her, please?
Just give me a second.
Yeah, it's okay to start with being online, but I would request at least once in a quarter, maybe 3 months, it has to be face to face.
Sure,
Because
sure.
you lose that, you lose something on a Zoom meeting. Once in 3 months I don't think is too much to meet face to face. Whatever you decide. Yeah, once in a while.
To do that. This time also we initially started with a physical.
Yeah, no, that's okay.
But because of the weather and everything,
Absolutely.
we
Yeah,
will
sure.
make a physical meet also with the mentors.
Ms. Meenu has raised her hand. She probably has something to share with us.
Hi, Megha. Hi, Dr. Walia. It was a very, very enlightening session. And like always, since I've been a part of support group for most of the times, I would second Megha on that whenever you meet a patient in person, it has a more, it has a very big impact. Your words, your body language make all the difference. Because I remember, and I always share this, that whenever you walk into a daycare center, as a person who has gone through cancer, your way of talking, your way of walking, everything impacts. It's like a patient waiting for the doctor to tell her what is in the report. I remember very clearly, and it had a very huge impact on me, that it becomes the responsibility of a caregiver to be really, really having that kind of body language that does not give a wrong message to it. So once I remember, I walked into the daycare and this lady, she actually pulled my hair just to check whether I got them back. Were they real? Were my eyebrows real? Were my eyelashes real? It gives you an impact, and you were like, and that made me realize how much of an impact it had on her. I really did not need any words. And she just told me, okay, ask me, are you able to walk properly? Are you able to run? Are you able to swim? So these kind of things make a big impact. So I guess as a mentee, our responsibility is also to have the correct body language and the words that we use. Also, let the doctor be their Google, not to give any medical advice, as Megha has also suggested. It's very difficult to give a wrong information and then correct it later. So it is better not to give information that you are not required to give. You are there for the emotional support. You can share your journey with them. Just try to handhold and encourage them. That's all you need to do. But your words, your body language, and as Madhu's also mentioned, we need to have that kind of guidance from the doctors. We are not their doctors. We are just there to support. Right? Thank you so much. Honored to be part of this and really looking.
Thank you so much, Meenuji. It's a delight to have you as a part of the panel. And one thing that I would like to say that I would encourage all of you to connect to your mentees, even personally, if you people can make it happen. Because for two people to meet, it's easier. For us to connect all of you, it usually gets difficult. So if once you start with this journey and if you can meet your mentees in person also, it will be really great.
We're looking forward for any other queries. Anybody, any questions? We have Miss Manisha Kumar.
Hi, hello everyone. Good morning, and it's a pleasure meeting all of you here. I just have a small, simple question here. Do we get an opportunity to at least, kind of introduce the mentees here who are there, or maybe, or it's going to happen over the phone later on? Nobody gets to know who's mentee, who is, something like that. Is that a secret or something?
So it will happen right after this program. You'll get the phone number of the person, and then both of you can connect one-on-one.
So maybe, do we get to see the mentees here only, like on the Zoom call right now? If they're okay,
Everybody can switch on their cameras
encourage them
to see everyone.
Yeah, I mean, at least we must know, who all of us are, and maybe not talking, but just looking at each other.
It'll be great if everyone can switch on their cameras.
Okay, there's somebody else who wants to say something. I think Madhu ma'am wants to say something. So that's all that I wanted to say. Thank you so much.
Thank you, Manisha. Madhu ji, can you unmute Madhu ji, please?
Megha, I think if people don't want to switch on their cameras, I think we should not. I think, it's very overwhelming initially because I know what we all went through. It's only bit by bit that people open up. I think it's perfectly okay. And we need to respect that confidentiality right away from the, that's it. Thanks. Yeah.
It's okay. It's absolutely everyone's choice. So whoever wants.
Whoever wants to, yeah.
That's okay. We'll do the one-on-one introduction right after the event. Like we will share the phone numbers and then we can take it forward from there. And I think we can conclude today's event today, and then let's take this mission forward. And I'm sure we're going to.
So all the best wishes to everybody who is involved with this initiative.
Thank you.
A huge thank you to all the distinguished panelists. Rajiv sir, who managed to squeeze out some time from his very busy schedule today, but he of course couldn't stay all through with us. Dr. Valia ma'am, Samara ma'am, and Megha ma'am, for your earnest initiative and generous time. We are indeed grateful for your encouragement and support. Thank you, dear mentors, for your kind and willing acceptance to join this cause. You're the heroes and pillars of this mission's success, and you have to take it forth to the apex of fulfillment. Thank you, everyone else who's been a part of this meeting today. Thank you.
Thank you, everyone.
Thank you so much. Thank you, everyone. Thank you.